interview is part of Penn's Elevate series, which encourages patients to take an active role in their care to improve their outcomes. So, as a provider, how do you empower patients and care partners to participate in care and treatment decisions?
So this is a great question. So I think prioritizing clear communication is very important here. So as physicians, we should always use clear and plain language to explain the nature of the disease and chemotherapy, including all the potential side effects, to ensure that patients grasp at least the essential information. So because it's often difficult for patients to absorb and retain everything during the initial consultation, I think repeating the same things over and over is key. Ongoing discussions are very necessary because that's how patients gradually build up their knowledge without overwhelming them in one visit. It's also very important to tailor the information to health literacy of each patient and cultural background. We should always adapt the depth and format of the information we provide to patients based on their level of understanding and their cultural background. Another thing is, I think, providing patients with summaries or visual aids can also reinforce all the information we talked about. There is a wide range of educational resources out there, including pamphlets with pretty good visual content and online videos. And I always routinely encourage patients to review these materials at their own pace. Next, I think it's important to encourage shared decision-making and of course, create an environment where patients feel heard and respected. So it's very essential to present all reasonable treatment options to patients and discuss the risks and benefits in a clear and balanced way. We should invite patient questions and create a space for patients and their caregivers to share their values, their goals, and concerns. Reinforcing that their preferences are central to our final decision, I think that further makes patients trust you more and also encourages other active participation. Another important thing that I've seen it's very helpful is encourage patients always to call with new concerns or like questions they have, because I know, I mean, sometimes patients just don't want to bother us, but I always say, look, if you have questions or new concerns, just give us a call. We're always here for you. Maybe I'm busy, but my nurse or my nurse practitioner can answer those. And last, I think as physicians, we should always involve patients' families and caregivers in all discussions to ensure that the patients have support at home. And connecting patients with support groups can be also of incredible value. I mean, these patients like really allow patients to share their experiences, learn from others, and I would say overall feel less alone in their cancer journey.
Yeah, that's great advice.
Yeah.
So part of making care decisions is setting treatment goals. So what is the goal of CAR T-cell therapy for myeloma?
So this is a great question, and this is a very important question when discussing treatment goals with patients. So the primary goal of CAR T-cell therapy in myeloma is to achieve a deep and durable remission and ideally minimal residual disease negativity in patients with relapsed or refractory disease. So CAR T is not considered curative, but I think that with CAR T-cell therapy, we basically aim to significantly reduce and eliminate most of myeloma cells. Thus, patients go into a complete remission, prolong the progression-free survival and overall survival of patients. Very importantly, improve the quality of life of patients by reducing the disease burden and symptoms, and offer basically a chemotherapy-free interval, which is very, very meaningful, especially for patients that have heavily pretreated disease and they've been on continuous medications for a very, very long time. So because myeloma is still considered incurable, it's very important to be realistic but hopeful at the same time. For some patients, CAR T cell therapy can provide remission periods of a year or more, and sometimes even much longer. We saw new data show that in one of the major trials, the 1/3 of patients was disease-free after 5 years of median follow-up. So that was very, very important. And all these expectations, of course, they depend on the type of product patients receive, their characteristics, and their prior therapies. So it's a combination.